Hi everyone. Thanks for coming back to my YouTube channel. My name is Kimberly Wilson. I'm a board certified nurse practitioner and have at least 20 years now medical experience in the nursing field. I am here to talk about all things weight loss, including diet, exercise, GLP-1 meds, whatever discussions we can get into in an honest and open forum. I am here to just share a little bit about my own weight loss journey, which has been 113 pounds weight loss in the last 18 months. But I am not here to diagnose anything medically, offer any medical advice, or prescribe medications. You should always discuss any of these topics that you're interested in with your own private medical provider and go from there as far as seeking any kind of diagnosis, medical treatment, diet, or medication plan. If you looked at our last video earlier in the week, it was about stereotypes and the way you may feel as an overweight person. Just wanted to relate the way I had felt over the last couple of years, struggling with, being overweight. This video, I wanted to talk a little bit more about why people, may choose to lose weight, or why I chose to lose weight, and kind of just offer a little bit of advice from there. So I personally wanted to lose weight for a couple of different reasons. I wanted to, of course, feel better, have more energy, fit in my clothes better, and stop having to buy, increased sizes of clothing. I wanted to look and feel better when I took pictures. And then I had a big, event in my life that was coming up that was family related that I also wanted to, make sure that I, felt and looked well for that event. I also enjoyed traveling and I wanted to be able to do that for many more years. I wanted to protect my bones, my knees, my hips, my joints, and be able to walk and exercise more. And then as I got older, as being a provider, seeing what obesity-related diseases and sometimes how obese patients can be treated outpatient and in the hospital, I also wanted to try to, avoid some of those situations by being more medically fit. So those are some of the reasons I lost weight. People lose weight for many different reasons. And there are many ways to lose weight. I mentioned I had tried everything from Atkins to, fad diets to low carb, high protein, GLP-1 medications, other medications when they were popular, including phentermine and things like that many, many years ago, intermittent fasting. But for me, it was a combination of a couple of different things. It was diet, and specifically what worked for me was low carb, high protein meals. Exercise as far as walking and making that, a significant part of my life. And then GLP-1 medications that we'll talk about in future series. But today I just wanted to talk a little bit about calorie counting. I know a lot of people focus on that, and I have done that in the past. Some people do not realize how to count calories or how many calories they may need when they're trying to lose weight. And I just want to make that very simple. If you take your weight, and again, this is a very simple algorithm, but if you take your weight, let's say 250 pounds, and you multiply it by 10, so that's 2,500. That's about how many calories you're eating per day in order to maintain that weight. So if you only make the change of eating less calories per day, in this case, let's say 500 less calories per day, so you would be eating 2,000 calories per day. At 500 less calories per day times 7 days in a week is 3,500 calories. 3,500 calories equals 1 pound. So a 250-pound person reducing their calorie intake daily by 500 calories for a 7-day time period would essentially lose 1 pound in that week without doing any exercise, any specific diets, just limiting their caloric intake. So this video, I just kind of wanted to focus on how do we count calories. If that is the way you want to go about it, simply multiply your current weight by 10. And again, this is just a basic framework. Multiply it by 10, and then just try starting with 300 to 500 calories less than what you're eating per day, knowing that in 7 to 10 days, you're going to drop a pound by doing nothing less. Now, eventually, after a few weeks, and you've lost a couple pounds, you'll have to redo your calculation, multiply it by your current weight, and again, reduce your calories. So you can't stay at the same calorie reduction forever. So you will have to adjust that. But just that simple way of starting can just kind of initiate some beginning weight loss. So before we get into other specific diets or medications or high protein meals or anything like that, for those out there that are looking for how do I even start to assess calories, that would be the way to do it. And again, when you're looking at labels and food and what is a calorie, we will also talk about that in future videos. I'll actually bring out some food products and we'll talk about how to read food labels because that's very important. Before you start any weight loss program, including calorie reduction, please consult with your personal provider, whether that is a physician, a nurse practitioner, a physician assistant, whoever takes care of your medical needs. And also consider seeing a local nutritionist who can really set you on the right path in deciding caloric intake, as well as what type of foods sound good to you. Because if you're not interested in the food you're eating, you will give up on it, you'll quit, you'll fail. So it's really important for your foods to be not only nutritional, but taste good, look good, be appealing, and that you want to consume them. And that's going to keep you on that path to success much longer. So I'm going to end this video here. These will just be really brief topics that we can talk about. Please like the video below, subscribe so you'll know when I am doing future videos, and we will get into just these little mini topics maybe 1 or 2 times a week. And if you want any kind of topic discussed specifically, put it in the comments below and I will try to address that as well. So until next time, maybe start by focusing on some calorie reduction, and then we'll get into some future topics real soon. All right, so take care, be good to yourself, and I'll see you next video. Thanks.